Last evening, I happened to see one patient, a lady, who came to me to visit for glaucoma evaluation in my clinic. She sat on the chair for examination purpose and started crying. She was almost unconsolable, but then once she was okay, we asked her what her problem was. She said that she was rather diagnosed with glaucoma, and she was afraid that she is going to lose her vision in near future. I just smiled at her and said that what made her think so. She told that glaucoma is known to be a blinding disease, and then anyway she is going to be blind in few days or few months. We examined her thoroughly and we found out that there was a minimal starting stage of glaucoma, and in fact she had good vision, and we assured her that with regular checkup and with regular medicines she would continue to have good vision and there won't be any problem. You won't believe how happy she was once she came to know that her glaucoma was not vision threatening. Most of us think that if one person is having glaucoma, it is probably the end of vision for them. It's not so. Glaucoma means a bit increase in the pressure of the eyes or something similar to that. If we can control the pressure of the eyes, or if we can diagnose what is the exact cause which is causing the glaucoma or increased pressure, we can very well control the process and patient can retain the existing vision for quite some time or maybe for a lifetime. I had a small kid, 16-day-old baby who had large eyes which was slightly whitish. We happened to operate on the child, and till today it's almost 5 to 6 years now. Baby is maintaining good vision, and I am hopeful that baby will have a normal life. Similarly, I had a young schoolgirl who was taking steroid eye drops for her allergic problems, and she also had glaucoma because of drug-induced complications. We treated her, and it's now almost 14 years the girl is doing very well. I also had a patient who is in mid-30s, a driver who came to me complaining that he was not able to see on the cars or the vehicles coming on the road from one particular side, his left side. When we examined the patient, we found that he was having glaucoma in his eyes. We started the treatment of this patient, and now with treatment, again his glaucoma is totally under control. Whatever vision loss he had has been arrested, and I am hopeful that he will be able to continue his profession as before. Most of the time, the increase in eye pressure leads to a damage in the nerves of the eye. Whatever part of nerve or eye which is damaged because of high pressures, that we cannot get back. But if we treat properly by either medicines or by surgery, whatever existing vision the patient has, that we can maintain for possibly lifetime. So, if we have a diagnosis of glaucoma with us, or a patient is having glaucoma, we should not lose hope. The only requirement is to get a regular checkup and to continue with the normal follow-up. And if any medicine is prescribed, it has to be used in a rigid fashion. If the doctor has told 2 times, it means 2 times in a day. Even if you miss food, it's okay, but do not miss your medications and do not lose hope. With the modern technology that we have, we can definitely arrest glaucoma at whatever stage it is in. Initially, we start with medications. We also have the option of lasers, and finally we have option of surgeries. In surgeries, we have open surgery, and nowadays we have tube surgeries. With these medications and tube surgeries, we are also able to maintain vision for nearly lifetime. Only in very late stage, if the patients have neglected their vision for quite some time or vision related problems for some time, and they end up meeting us at a very late stage when the vision is quite low, then it may be a little difficult to treat. Even then we have an option of low vision clinics wherein we can try to retain the existing vision and train the patients to utilize the existing vision in the best possible manner. My advice would be that whoever, like any one of you who care for their vision, must go for an eye checkup at least once in a year. If you have any problem in the eyes, then it would be better to get checkup done little earlier. And if there is a family history of glaucoma or any other eye disease, then I would suggest to stay in contact with eye surgeons or eye doctors 6 months to 1 year in around 6 months to 1 yearly timings. If you have a history of any eye problem, or if there is a history of family members having glaucoma, then it is advisable to have a checkup around 6 months to 1 year time. Thank you.